Monday morning, the 25th of July, and our top story is that the NHS in England is facing the largest workforce crisis in its history. That is the warning today from a crossbench group of MPs.
A new report from the Health and Social Care Committee suggests the number of unfilled job vacancies is posing a serious risk to patient safety. The government says the workforce is growing and NHS England is drawing up long-term plans to recruit more staff. Dan Johnson has the story.
So these green arrows tell me that these patients have finished their care in the A&E and they're waiting for a bed on the ward.
There just aren't enough staff to look after all the patients. And MPs say the government is lacking a credible strategy to improve things in our hospitals and surgeries. The Health and Social Care Committee found that persistent understaffing in the NHS is creating a serious risk to staff and patient safety.
As you can see, the department's really busy at the minute.
It says the NHS in England is short of 12,000 hospital doctors and more than 50,000 nurses. Maternity services are under unsustainable pressure after more than 550 midwives left the profession last year. The number of GPs also fell by more than 700 over the last 3 years, despite a promise to provide 6,000 more. It's predicted an extra 475,000 staff will be needed in health by the early 2030s and an extra 490,000 in social care.
We are living longer, we are getting sicker, we need more care. And that care doesn't happen by itself. We are fundamentally a business that is made of people, and we have to have a plan that speaks to all the people that work in the workforce. So what the government has to do, what the new Prime Minister has to do, is publish that plan, John, and then be really clear about his or her plans, the investment that's going to be made to address the problems that we face.
The Department of Health and Social Care said the workforce had grown in the last year and it will recruit thousands more nurses by 2024. But the committee recommends better pay for care workers and changes to the NHS pension scheme to stop staff leaving. It says to keep patients safe, the incoming Prime Minister will have to tackle long-term understaffing, now described as the greatest workforce crisis in the history of the NHS. Dan Johnson.